morning, Dr. Anggi. Thank you so much for joining us.
Hi, good morning, Mbak Marisa.
Doctor, could you please explain how prevalent or widespread is cervical cancer in Indonesia?
The prevalence of the cervical cancer in Indonesia is still at the first rank of the gynecology cancer. So, if in our hospital has a kind of 5,500 patients, 85% are the cervical cancer. So almost 85% patients from the gynecological cancer are cervical cancer, and most of the patients came in advanced stage 2B and 3B.
Right. So what are the symptoms of cervical cancer?
Well, early stage cervical cancer generally produces no sign and symptoms. And most of the signs and symptoms come in advanced stage. So usually they come with complaint of vaginal bleeding after sexual intercourse, or intermenstrual bleeding, or the bleeding between the period, or the bleeding after the menopause. Sometimes they don't come with the chief complaint of the bleeding, but they come with the chief complaint of the odorous, watery vaginal discharge, pelvic pain, or pain during sexual intercourse. Those are most common sign and symptom. But remember, in the early stage, there is no sign and symptom. So you should be careful and do regular gynecological examination.
Right. So
And nowadays, yes.
yes, go on, doctor.
Yes. Nowadays, women thought that if they are not pregnant, they do not have to visit the gynecologist, but that is wrong. So even though they are not pregnant, they should visit regular to do the gynecological examination.
Right. You mentioned about pregnancy. Is it true that I read on a WebMD earlier that is it true that pregnant women can also get cervical cancer? Could you please clarify this for us, doctor?
The pregnancy woman, of course, every woman has at risk for having a kind of a cervical cancer. So the risk factor for having this kind of cervical cancer, as you already mentioned it before, that the cervical cancer is type of cancer that occurs in the cell of the cervix, right? So the cervix itself is the lower part of the uterus that connects to the vagina, and is which is the location which is located at the 7 to 10 cm from the opening of the vagina.
Right.
So the risk factor for having this the infection of the HPV, the cause 99% the cause of the cervical cancer is linked to the infection of the highest human virus is the
Hello, Dr. Anggi. Are you still connected with us? We are still trying to connect with Dr. Anggi at the moment. Yes. So some of the health conditions or factors that can potentially increase a person's risk in developing cervical cancer, according to WebMD, are these following conditions. For example, human immunodeficiency virus, or HIV, and then chlamydia, smoking, obesity, and so on. Oh, Dr. Anggi is back with us. Thank you so much.
I'm sorry.
It's okay.
I'm so sorry.
It's okay. This is the new reality, doctor. When the pandemic came, we all have to work from home and everything. So this is the way we interact.
Indeed.
So we're very happy to have you here. Yes, my next question is, you did mention a little bit about the cause before we lost you because of the not so good network there.
Indeed.
So I will ask this question again. Is cervical cancer genetic, or is it caused by unhealthy lifestyle?
Yes. the cause of the cervical cancer, 99% are linked to the infection of the human papillomavirus, or we call it HPV.
Right.
Yes, yes. Although this HPV infection will resolve spontaneously and do not cause any symptom, but the persistent infection will lead to the cervical cancer. Because of the infection, because the cause of the infection, actually the cervical cancer is not hereditary gynecological cancer or related to familial cancer. Hence, actually, the cervical cancer is preventable disease. But unfortunately, as I already mentioned it before, that even though this is preventable disease, preventable cancer, that the incidence of the cervical cancer is still at the first rank of in the gynecology cancer in Indonesia, and most of the patients came in the advanced stage.
What is the cause of that high numbers, doctor? I mean, is it because not enough women in Indonesia, or not a lot of women in Indonesia, get themselves vaccinated with HPV vaccine, or is it their lifestyle, or they don't screen themselves regularly? What's the case here in Indonesia?
The case is it's not whether you are getting the HPV infection or not, because as I mentioned
Oh
it
no, I
earlier,
meant
that this is
vaccine. The vaccine.
yeah. It's yes. I get the questions. That this is preventable disease. Why this is preventable disease? Because this cancer actually grows slowly. So from the infection, it's not directly changed into cervical cancer.
Right.
So after the infection, we have the incubation phase. Once the virus enter the body, will take about 12 to 20 months to develop precancer lesion, not cervical cancer. Is this cervical cancer? Not. This is precancer lesion.
Right.
In this precancer lesion, we can do the prevention, such as do the pap smear test, VRA test, SPV DNA typing test. So it was a secondary prevention. So it means, what is the secondary prevention? When you are at least for having this HPV infection. So it means that you are already sexually active, that you can do the secondary screening. And in this situation, it's curable disease. It will be cured 100%.
Wow.
The problem, the coverage of the cancer lesion screening in Indonesia is very low. Sometimes it's not related to the social economy or educational level. The women just do not want to come and do the examination. That is the problem. WHO said that to decrease cervical cancer, that you should the coverage rate of the screening should be up to 80%.
Right.
But in Indonesia, only 8 to 10%.
Right.
So that is the problem. And then once you are diagnosed for having this precancer lesion, what does it mean? It means that if it is not properly treated, that it will lead to cervical cancer within 3 to 70 months. So it's quite so long. It's not changed in the short period of time.
Right.
And yes, you are right. To reduce the incidence of the cervical cancer, by doing the screening as a secondary prevention, and also in combination receiving a vaccine that protects against HPV infection, especially high risk type 16 and 18. Also will increase the chance for you not to getting this cervical cancer.
All right. So how regular should women, probably in their 20s or 30s and above, get themselves screened to make sure that they can catch this potentially dangerous disease early?
Yeah, so it depends on the result of the screening. the doctor will give you the guidance how regular is should you do the screening. If you are doing the VRA test is visual inspection accident exit, and the result was negative. The result is negative. It means that you can repeat the screening for another next 3 years. If you do only pap smear test and the result is negative, the same. You do regular pap smear test another 3 years. But if you have a combination, the pap smear test and the SPV DNA typing test, and the result both at the same time are negative,
Yeah.
you could do repeat the screening for another 5 years.
Okay.
So it's not every years or every 6 months, no.
Okay, doctor.
We have the, yeah.
Let me just underline what you just said there. You said that women, you advise that women do their pap smear regularly. And what is the name of the test again, doctor? The SPV DNA test.
SPV DNA typing test,
Oh,
yes.
DNA typing test. Okay, I'm gonna note that down
Yes.
for my own note actually as well. And you also mentioned about the low number of women getting themselves tested regularly, right? What is exactly the cause? Is it because of the discomfort? Is it because of lack of information? Or is it, what is the reason? And how do we actually encourage more women to get tested so that, we can reduce the number of cervical cancer patients in Indonesia?
That is our homework as well. That until now, the coverage of the screening is still low, and as I mentioned it earlier, sometimes it doesn't related to the society or economic stages or educational level. The women just do not want to do the screening. So the need to increase the awareness to do the screening is the important thing. It's not only for the woman, but also for the husbands and also for the society. And nowadays, the government has provided wide screening to increase the coverage of the cervical cancer screening by the VIA test. And we do hope that we can achieve the 80%, which is still far away because nowadays our coverage is still 10. So for this, for media, I think has an important role to spread about this information to the society, that this is very important because this is preventable disease.
Yeah.
Not hereditary gynecology cancer, so you can prevent it. If you can prevent it, it can cure 100%.
Okay. Doctor, you mentioned about the vaccine earlier, right? I remember I had my HPV vaccine, man, probably it was 10 years ago. Is it the type of vaccine that you get only once but 3 times?
Yes.
Or you have to repeat after a certain period of time?
Until now, we do not have to booster the vaccination that we already have. So 3 times in 1 time, it's enough.
It's enough. Okay, so I'm okay.
The rest, you do the screening.
All right.
Yes,
and also do the screening regularly. You mentioned about the screening process, the SPV DNA something testing. I keep forgetting. Typing testing. So what is the process of when you get that test? Because right now, when you mention that, I'm like, oh my God, is it going to be long? Is it going to hurt? Is it scary? Could you please clarify it for us, doctor?
Yes, you should explain about the scary because the location is 7 to 10 cm from the opening of the vagina. So when the doctor wants to do the examination to the cervix, we have to do the inspection, and we need the tools that we call it speculum.
Yes.
In Indonesia, we call it cocor bebek. That is the scary tools for
Right.
most of the women. Oh, no, 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 that tools scary. But that is something that we have to do. I mean,
Yeah.
we insert the speculum and we do the swab, not taken the biopsy,
Mm.
only the swab of the cervix. So just smooth swab.
Mm.
So it won't giving a painful feeling. No, it's different when we have to do biopsy for the cervical cancer patient, but for the screening, only the swab.
Okay.
That's it.
All right.
We'll be finished before you close and open your eyes again. So before you blink, it's already done.
Thank you
Yes,
for the
yes.
kind encouragement there, doctor. You mentioned
Yes,
earlier
of course.
there is the word DNA in the SPV DNA testing type, right?
Yes, yes.
So, what is that? Does that mean that the lab is trying to examine whether you have the whether you have cancer in your genes or whether it's hereditary in your family? Is that it?
Uh, the SPV is the DNA virus. If you know about the COVID, it's RNA virus. So
Yes.
DNA is located at the inside of the nucleus. So it's in the core of it will affect to the inside of the nucleus. So the DNA will give a specific difference with the specific examination. Like you do the PCR for the COVID-19.
I
So it will
see.
show it that, oh, you know what I mean? So it will show that, oh, this is the existence of the SPV. And nowadays they can also differentiate what kind of the type of the SPV, whether this is 16, 18, 31, 33, 35, 41. We have more than 15 types of high risk SPV that can cause cervical cancer.
Right.
But the 85% caused by the high risk SPV type 16 and 18 that
Right.
you get for your vaccination, 16 and 18.
Okay. So, cervical cancer has its treatment, right? So after, for example, after a cervical cancer patient undergoes or finish doing his or her treatment, going through a thorough treatment, can cervical cancer come back?
The cervical cancer, of course, when we are talking about the cancer, we do not say it's cured 100%.
Right.
It's different when you are suffer from precancer lesion. The precancer lesion is not cancer, so it will be cured 100%. But when you are diagnosed for having cancer, that you are having a chance to get relapse.
Yes.
Because what is the difference between benign or malignant cancer or not? The benign tumor stay in the home, not go everywhere. But for the malignant, there is an infiltration to the stroma, and in the stroma there is a vessel, so that is why that the cell can spread to anywhere. When the doctor do the operation, we only be able to take out the tumor.
Yes.
And the tissue surrounding the tumor, and the spreading through the lymph node.
Yeah.
But the spreading to the vessel, we cannot take it out the vessel. Oh, we want to cut this vessel. No, we cannot. So that is why there's always a chance to have relapse once you are diagnosed as having a cancer.
Right. Right.
So that is why that you should do a regular examination.
Yes, I could not agree more with you, Dr. Anggi. Thank you so much.
Yes,
Dr.
indeed.
Tricia Dewi Anggraeni, a gynecologist from MMC Hospital. That is one message that is very, very important. In summary, cervical cancer is preventable. You can get yourself vaccinated. And also, please, 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 as Dr. Anggi says, remember to schedule your screenings regularly, either it's with your OBGYN or a gynecologist, to help maintain your reproductive health. Thank you so much again, Dr. Anggi. Have a lovely day. Yes?
Yes, thank you.
Bye.
Can I add more
Yeah.
what information?
Yes, sure, doctor. Just very briefly.
In
Yes.
short, because it's briefly, because it's very important that I would like to remind all the women that, like you always mentioned, that do regular cervical cancer screening, and if you have any sign or symptom, do not hesitate to come to your doctor. And if you once diagnosis as having a cervical cancer, uh, do not delay to get treatment.
Yes.
Sometimes the problem that the patient like to delay the treatment because of they are afraid that there will be the impact of the treatment to the patient. So this kind of thing that is very important for the patient. Thank you.
Thank you,
Marisa.
Dr. Anggi. Thank you so much for sharing your expertise. You have a lovely day.